Iron is essential for life. So if we think about humans, we need a couple of things, one of them being oxygen. So iron is what carries oxygen in our blood. A decrease in iron leads to a condition called iron deficiency anemia. And that's basically when there's not enough red blood cells functioning and carrying oxygen. This can present with fatigue, tiredness, shortness of breath, severe cases, even cardiovascular problems where we have arrhythmias or inconsistent heartbeat or irregular heartbeat. The main causes of iron deficiency is either a lack of ingesting it, absorbing it, or losing iron. So who is prone to iron deficiency? Firstly, women, for one specific and very simple reason: menstruation. We lose blood, therefore we lose iron. Vegetarians who do not take in enough iron through their diet. We go to more serious conditions, and some of them asymptomatic, where we have a peptic ulcer. It's losing a couple of drops of blood a day, which you don't pick up. Polyps, hernias, etc., etc. So if you present with some of the symptoms of fatigue, pallor or pale skin, hair loss, weight gain, changes in sleep, ask your practitioner to maybe take a look at your iron levels. There are different ways of supplementing them, something that we will discuss in one of our next posts. If you want to know more about iron and iron deficiency, or if you want to check your levels, contact us at the T Clinic on 010-824-1393.